I am Luciano Nardo. I'm Clinical Director at the Reproductive Health Group, which is a standalone fertility, gynecology and IVF clinic in South Manchester, exactly in Cheshire, between Manchester and Liverpool. We have been granted by the HFEA last week, Tuesday, the permission to resume fertility services, which obviously came with great pleasure, but also with much surprise, because we weren't expecting a response within 16 hours. So I lead a team of clinicians, embryologists, nurses, and administrators within our clinic. So we were all very, very pleased for our patients. We started the clinic 6 years ago, and we have grown the unit to include now, apart from genetic testing, but also we have extensive male fertility experience with 3 urologists working within our clinic. I also work as a gynecologist, but in Manchester and in London, and I cooperate with a number of physicians, endocrinologists, gastroenterologists, and general surgeons to deal with general gynecology, pelvic pain problems as well. So within our clinic, we don't just look at the fertility side, we look at the general gynecology aspect of women's health as well. Well, we are living, or we are suffering more than living, a pandemic of a proportion that has not been previously experienced. Certainly in my lifetime, and most of my colleagues' lifetime. And there have been many challenges posed by COVID-19 to our patients, our staff, our healthcare system, to our community. So we had to put in place several measures to protect all of those: staff, patients, the community, the NHS, and more importantly, to ensure that our patients have confidence in restarting treatment within we call it a safe and effective environment. So we decided to change completely the way our workload and our daily schedule works. So we have spaced or staggered appointments. We have divided the overall team into small teams to ensure that there is less contact between patients and staff during the day, so patients can come at different times of the day and meet different members of the team, but also between staff themselves. We have made some rules, and we have produced a code of conduct for our staff that entails simple things like you cannot have a cup of tea or a cup of coffee on your desk, or you cannot swap desks with colleagues, or you cannot use somebody else's phone. You have to maintain your desk clear all the time. So actually our cleaners can constantly clean the desk and keyboards and everything else around us. We have produced a code of conduct for our staff to ensure that our staff, like our patients, they feel empowered, but also responsible to maintain a very, very safe environment. We have created a code of conduct also for patients, together with a consent form for patients, because we wanted to make absolutely clear that our main objective is obviously to treat patients, not to delay any treatments. Yeah. But this comes with a price, and the price is to keep everyone safe. In cases when we are not certain about the possibility of somebody being infected, then they need to be tested. And we have introduced within our clinic the specific testing, both for current infection and past infection. We have put in place a number of measures, which I will describe in a second, to ensure that patients, from when they come into the clinic to when they leave the clinic, they have very, very little contact with anyone else, but also they are protecting others. So we have decided to establish something that is quite actually common in other practices, but wasn't common in the medical practice, and that is a temperature screen pod. So it's like a glass cubicle, and patients from outside, they walk into this glass cubicle, which is similar to going through an X-ray machine when we are traveling at the airports. And so from outside, they step into this glass cubicle and they get the temperature checked before coming inside the building and going to the waiting room. And obviously, if they have temperature, then they're not allowed to come in. They will be completing a triage form to ensure that there is no the underlying reason for concerns. They will be wearing PPEs. So every patient embarking on treatment, we have created specific patient personal protective equipment packs, which include some sanitizing gels, some gloves, some masks, some salviettes, but also a specific mask called FFP2-3 mask that they will be wearing after any procedure. We have ensured that patients are directed to the upstairs or the downstairs waiting areas to minimize the contact between patients. And as I mentioned earlier on, we staggered appointment in clinic, but we have also decided to combine some clinics so to avoid that there are too many patients in the waiting room at any one time. To be honest, our practice itself hasn't changed very much in the way of how we conduct our appointments, because we used to do many online consultations before, especially as 1 in 4 of our patients travels more than 100 miles or travels from overseas to come to our clinic. So we had well-established online platforms and virtual consultations. But of course, we had to make more I would say routine use of this, is also for signing consent forms, for medications teach for the patients, and also for some reassurance appointments when actually patients don't really need to come to clinic, but they used to come to clinic just to have a face-to-face consultation, perhaps with a care coordinator, with a nurse. So we have created for each team, and that is the embryology team, the clinical team, and the nursing team, some specific Zoom accounts that will enable patients to get in touch and obviously see the embryologists and the nurses and the physicians should they have any concerns about their ongoing treatment, or indeed if they're planning to start treatment, they have got some specific questions. But also that has helped us because we've been able to schedule our consent appointments remotely. And that is something that has changed in our practice, because until now we used to have couples or individuals coming to clinic and sitting around the table and all of us signing consents together. So I think this is part of evolution in our field, and we are making best use of the digital resources to mitigate the risk of infection. But admittedly, this will be the new normal.
Yeah.
So I always say to I keep saying to my staff that before COVID-19, certain things would have taken a long time to come to fruition. It would have taken so long time to make a decision and to change the way we do it. But because of COVID-19, we have demonstrated that things can happen overnight.
Yeah.
And I think this is an example. We would have had many debates whether all consents should have been done remotely or not, whether partners should have been present at the same time or not. But actually, we've realized that it's not a great deal doing them remotely. In fact, lots of people prefer them, and it's good for the clinic as well, because you have less patients coming through the doors when they don't actually need to be examined. So we are trying to limit the access, access to clinic to patients and visitors. Obviously, unless they need a physical examination, they need a blood test, they need an ultrasound scan. We are very fortunate within our clinic, because actually the clinic is a standalone clinic extending on just under 15,000 square feet. So it's a very, very big building on 2 floors. And we have 6 separate consulting rooms with ultrasound facilities. And we have 8 inpatient rooms with their own ensuite. And we also have 2 operating theaters and a 3,000 square feet embryology lab. So we have got ample space. Now, obviously, 6 years ago, when myself and colleagues built the clinic, we were not thinking about COVID-19 in 2020. But we wanted to create a state-of-the-art clinic that was going to provide patients with, to some extent, the independence from everyone else, with not isolation, because we didn't call it isolation at the time, but with privacy. Hence why we created the clinic as it is, with very large waiting rooms. We have 2 large waiting rooms with separating the downstairs from the upstairs as being consulting only, from operating and inpatient admissions. So we are very fortunate, because given the size of the clinic, we don't have to limit the number of treatments. So we have, however, come up with a strategy plan that we have submitted to the government regulator, HFEA, showing what is the maximum number of procedures that we can do every day. And I think that will not impact on our really on the demand at the moment. And we are quite flexible as well, that if we are reaching that sort of capacity, we have to make additional changes to our workload and perhaps daily schedule, so to accommodate more patients. And myself and all the staff at the Reproductive Health Group, I've got that commitment to facilitate patients' journey without causing any necessary delays. So the answer is no, we don't have to limit the number of treatments, we don't have to limit the number of investigations, and there is no test at the moment that we've been asked to provide, to do, or that we used to do that cannot be done. To be honest, we don't have to prioritize patients, because when we were told by the HFEA to stop treatments by the 15th of April, we had a very good schedule in place. So all patients that were in treatment, they completed treatment. So we didn't have to cancel, even at the time, any patients. We decided to postpone the embryo transfers. So the patients at the time were advised to postpone the embryo transfer. Of course, some patients took that advice, some didn't, but we didn't have to cancel treatment cycles. In fact, we managed to complete all patients' cycles 5 days before we were supposed to complete each cycle. Now we've restarted, and as I said earlier on, because of the size of our clinic, and I also like to say the flexibility and commitment of my team, we have made the decision not to prioritize patients.
Okay.
But of course, within our strategy plan, we had to create some degrees of priority, and that will be essentially for patients that have got cancer. So that will be for fertility preservation. So should we become sadly too busy and we cannot accommodate all treatment, I think patients requiring fertility preservation because of cancer or cancer treatment will get prioritized. Now, we're also very mindful that fertility or infertility is a disease. and no one will choose electively unless there is an underlying genetic problem to have IVF. So IVF has to be provided in a very timely fashion. And we believe, and I personally believe, that will make no sense to create a list of patients and then choose from that list the one that got higher priority, because it's not really ethically and clinically correct. This is a very good question, and the question actually that was asked by a colleague of mine today. We have introduced for all our patients, apart from a consent form and a code of conduct for patients, also a triage form. As I mentioned earlier on, the patients will be invited to complete the triage form at the beginning of the treatment cycle, and then a baseline scan on the day of recollection, on the day of embryo transfer. As part of the triage form, we ask patients whether they have any underlying medical problems. And the one we will be looking at, obviously, will be any lung disease, any cardiovascular disease, any kidney disease, and any immune diseases. So anyone that may present with an underlying medical problem will not be refusing or asking not to enter the clinic or asking not to join an IVF cycle, but instead we will be putting that patient through the standard triage pathway. We will then be discussing the case with one of our 6 anesthetists that have all got experience in intensive care units. And if needed, then we'll ask the anesthetist to speak to the physician under whom the patient is currently cared for. So for instance, if there is a patient that has got an immune disease for an underlying immune problem, then we will want to see whether there is a risk for that patient to be further immune compromised by getting pregnant or having treatment.
Yeah.
So anyone that has got underlying medical problems will be triaged as usual, but will be also discussed as part of a multidisciplinary team to ensure that the treatment cycle and the future pregnancy are not going to impact negatively on our general well-being. Well, if somebody is tested positive for coronavirus, depends whether actually has had antibodies testing, which means had been previously exposed to coronavirus, or whether it's got symptoms and it's got PCR evidence of coronavirus, which means she's currently has coronavirus. So if somebody is asymptomatic, so it's got no symptoms whatsoever, which I would like to make that statement here, that up to 80% of individuals may have no symptoms or very, very, very little symptoms.
Yeah.
So if somebody has got no symptoms and has had symptoms in the past, or has had antibodies testing which show that has been exposed to COVID-19, then there is no need to delay treatment.
Okay.
She and her partner can start treatment.
Yeah.
If instead we have a patient that presents with symptoms, so she will be triaged as positive, then she will be invited to have a blood test for PCR, by PCR, which is blood test to detect coronavirus. And based on the results, then obviously we will advise whether she can go ahead or not. But generally, if somebody is symptomatic, we would advise to wait at least 2 weeks from the onset of symptoms. Well, if somebody becomes symptomatic while she's undergoing treatment, yes, we will advise to postpone the treatment cycle. If she becomes symptomatic after a collection, we will advise to freeze the embryos. Yeah, part of our code of conduct refers to physical distancing. So we would recommend that patients undergo treatment. They adopt some safety measures, so they avoid doing anything that could pose an increased risk of COVID-19 infection. So apart from the usual hand washing and hand sanitizing and wearing a mask and ensuring that they are not in contact with people outside the household, we would also recommend that perhaps while they're undergoing treatment, they work from home, if they can work from home, and they have very little contact with anyone else that is not actually within their household. So they don't have to, strictly speaking, self-isolate, but they have to use some measures to protect themselves and protect other patients and protect the staff in the clinic.
Yeah.
So our code of conduct is that patients should wear masks when they go outside. They should limit contact with others, and if possible, work from home. Yeah. Of course, we are very keen to provide as much support as possible for our patients. And over the last 6 weeks, we've been running 3 times a week on a Monday, Wednesday, and Friday Q's and A's with our nurses. We've been running 3 or 4 webinars every day with our partners, these being counselors, reflexologists, nutritionists, and fertility coaches. We have a large network of over 20 partners working within the clinic, and they all provide different aspects of complementary medicine. Now, it is very important. This has been a very, very stressful time. And as I said, it's one that I sincerely hope most of us will not have to live again. And unfortunately, in my opinion, and based on data from Public Health England and some epidemiological studies, we will be with coronavirus for a while. So we have to accept the changes.
Yeah.
We have to get used to the new normal, and it's not going to be easy. It's not easy. It's not easy for me not to go out twice a week. It's not easy for me not to plan a holiday. And there are so many other things we used to do that we cannot do now. So that is the new normal.
Yeah.
What we've decided to do within the clinic is to provide all our patients with as much support as possible. One of the things that we've been doing recently, we have joined the Fertility Network UK as a pledge clinic, because I personally believe that patients embarking on fertility journey, they embark on a long and emotional, sometimes heartbreaking journey. And the stress, the expectations, the anxieties, and sometimes the constraints posed by COVID-19 will add to that level of stress.
Yeah.
So we're working with numerous partners and fertility coaches and counselors, because we believe that patients should receive as much support as possible now more than before.
Yeah.
And this is very important for anyone embarking on fertility treatment, but also for single women that may find very difficult to go out and meet with friends and perhaps sharing their experience and daily life with others. Yeah. And they will embark on this journey completely on their own. Hence why we offer a 24/7 line support. Our patients come to the clinic, they can contact the clinic during working hours from 8 until 6, and then from 6 until 8 o'clock the following morning they have access to a mobile number and they can call for anything. So emotional support, I think, is fundamental and is as important as the clinical expertise that we can offer to everyone. It is also very stressful, thinking, or perhaps not knowing what happens if somebody gets pregnant, what happens in pregnancy and during pregnancy. So again, we have a midwife working within our clinic that can advise patients or what happens, what to do. Because it's inevitably a concern that some patients may have. Say, well, we are going to create embryos, we're going to put ourselves, or I'm going to put myself through this journey. But what happens if I do get pregnant? Well, very interestingly, we published at the, I think it was the back end of last week, an update on our website about COVID-19 infection and pregnancy. And on the 11th of May, there was the publication by the UCOS, which is the UK study group looking at outcome of pregnancies in women affected by COVID-19. And this data is routinely available on the Royal College of Obstetricians and Gynecologists website, as well as on our website. And it is very reassuring that COVID-19 is not associated with an increased risk of miscarriage, is not associated with an increased risk of fetal and or maternal complications. There are some women in the report, which included just over 420 women with COVID-19 that had been admitted to hospital, but it is unknown at this stage whether they had been admitted to hospital for COVID-19 related or unrelated circumstances. However, what is very, very clear is that some ethnic minorities, as well as Black and Asian women, seem to be at an increased risk of developing more severe complications because of COVID-19. It is still unknown what is the relationship between some ethnic groups and risk and severity of COVID-19. But I'm pretty sure that epidemiological data and studies will become available and provide more information in the next probably 3 to 6 months. So on the basis of this, I would like to reassure our audience that COVID-19, if anything, is actually less severe than the normal influenza in pregnancy. However, if you are in one of the ethnic groups highlighted as being Black, Asian, or ethnic minorities, I think perhaps for the time being I would recommend to be cautious and consider a freeze-all strategy until we understand a little bit better what are the consequences. Because the consequences are, I would say, very, very important in order to determine the most appropriate, evidence-based treatment both for the mother and the fetus.
Yeah.
But the data that have been published, which include women in the first trimester of pregnancy, as well as in the third trimester of pregnancy, suggests that there's no risk of developmental problems, there's no risk of abnormalities, there's no risk of miscarriage.
Okay.
However, it seems that in addition to the symptoms we are used to know about COVID-19, that being lung symptoms or dry cough and short of breathness and perhaps some temperature, but it seems that COVID-19 infection may also increase the risk of blood clots.
Okay.
So that is important in pregnancy, and that is important in pregnancy because the blood has to flow well between the the uterus and the placenta and the fetus. So we need to be absolutely certain that there is no complication associated with blood clotting.
Mm.
So the groups of patients I've described before, so Black, Asian, and ethnic minorities, should perhaps consider carefully embarking on a pregnancy at this point in time and receive adequate preconception advice.
Yeah.
It is debatable. It is interesting because no government worldwide has warned the population about using contraception during COVID-19. And I just want to make clear that the reason why professional societies, the reason why clinics like ours, the reason why the Human Fertilization and Biology Authority in the UK and other bodies across the world have given advice to clinics to stop treatment is essentially to reduce the impact on public health.
Yeah.
Also, to do with potential risk of clinics having to quarantine staff and treatment cycles being cancelled last minute. And clearly also with the lockdown.
Yeah.
But we know, and the American Society for Reproductive Medicine first, followed by European societies and different professional bodies, have stated in the last 6 weeks that infertility is a disease.
Yeah.
The WHO has confirmed that infertility is a disease. So although it's not critical care,
Yeah.
however, in most cases, is urgent care.
Yeah.
Hence why patients that have been able to resume treatment, they will continue to receive treatment. But the important thing is just to reassure again our audience that what happens if a clinic has to close down because high incidence of COVID-19 infection within the clinic.
Yeah.
Every clinic in the UK, as part of the strategy plan to resume services, had to have in place a contingency plan, also known as reciprocal agreement, which means that our clinic has got a reciprocal plan with another clinic should anything happen. The thing we don't want to do, and the thing we are particularly careful for, is avoiding the patient's journeys are stopped,
Yeah.
avoiding that cycles are cancelled. And as a private clinic, we want to avoid that patients' finances are affected.
Yeah.
So by having a reciprocal agreement with another clinic, we do as much as we can to ensure that the treatment cycle can come to an end. And that is after a collection. And sometimes if we recommend to do a frozen embryo transfer cycle and later on is for the best interest
Yeah.
of the patient. I think the subject of resuming fertility care in the UK, but I think worldwide, globally, has been really well explored in the last 2 weeks.
Yeah.
That I think is very much based on common sense. It's very much based on safety and effectiveness within clinics, bearing in mind both patients and staff should be kept safe.
Yeah.
There is no evidence whatsoever that COVID-19 could be transmitted in the lab.
Okay.
At the moment, although there have been some very sparse reports of COVID-19 infection in the seminal plasma, so in the ejaculatory samples, there is no yet study that confirms that in a reliable fashion. Women that have eggs frozen or will have eggs frozen, at this point in time, they don't have to be concerned at all about the risk of having their eggs infected.
Okay.
Should there be somebody else that has got COVID-19. Equally, there's no risk of infection for embryos. So, of course, other measures have been implemented in the lab. But that is predominantly to protect patients while they're in clinic and staff while they assess semen samples or doing egg collections or while defrosting eggs before embryo transfers. That's the reason why we were very pleased for being able to resume treatment, and we had worked very hard the week before submitting our strategy to the government regulator.
Yeah.
But we're also quite pleased how responsive the HFA has been in providing clinics like ours with permission to restart services. And I think we are very fortunate in this country where there is a regulator that provides some guidance to clinics, and that I think has to be seen, although it's been somehow criticized by some clinics and also by some patients. However, in my opinion, having a regulator helps to keep good quality of standards, and more importantly, to set the bar high for clinics to perform well, and to ensure that treatment is offered to everyone, but also bearing in mind what are the criteria that each clinic should adopt in order to resume services, rather than thinking that you can complete a sort of tick box exercise. I think it's a little bit more than that. And the HFA has produced a self-assessment questionnaire for clinics. There were 50 questions in this questionnaire, and each clinic that has applied had to fulfill the 50 points. So it is quite an exercise. We were very pleased, but also quite surprised. We were not expecting that quick response, and that shows that actually the HFA officers have also been working as hard as a clinic staff to ensure that they were there ready to give clinics permission without delays. Yeah, but one more thing which I think I'd like to highlight, and I think in the context of what we've been discussing, so the resumption of fertility and IVF treatments during COVID-19 pandemic actually relates to support. And organizations like Fertility Circle, Fertility Network UK, and many worldwide patients groups and organizations have also done an amazing job in ensuring that patients have not lost that morale, have not lost the excitement to restart treatment, because sometimes when treatment is taken away from you, you may feel that you missed that opportunity. So I think clinics have done a great job, but many other partners and many other organizations have been equally important, if not even more important than clinics. We are very fortunate in our organization because we have a dedicated team that leads on communication and patient support and patients' well-being and counseling. So it's been easy for us to organize what we've done. Every day we had a different subject, but I know that some patients being seen in other clinics may not have received that. And what is crucial, has been crucial during the last probably I would say 2 or 3 weeks, is educating patients about the new normal, because that is very important. That is something that has to be in place, has to be put in place, because things will change. And so educating and rather than training, educating patients about the new normal and has helped, and in the future will help to mitigate expectations. And to know what is best for everybody. So we endeavor to continue providing within the clinic support groups for our patients, because I think they have proven to be quite useful. We will not be doing them as often as we've been doing until now, which was 3 times a week. But we'll certainly be carry on with that support, just to mitigate anxieties, mitigate expectations and to provide everyone with a genuine feel of good mental health. And we have encouraged our patients in the last probably 4 weeks since we had to stop treatment, actually to focus on something positive every day.
Yeah.
And although it's very, very difficult, it's been very difficult for me not to listen to some updates about coronavirus, if that was by Public Health England or Department of Health and Social Care or the government or anyone around me or colleagues or even my own children talking to me about coronavirus. However, it is important, and we have recommended that all patients should take some time aside every day to focus on something positive. If that is about the new healthy regime, if that is about exercise, about something good in the relationship, if that is something positive about changes in the workplace and perhaps meeting friends using different platforms, different channels, I think I would highly recommend that everybody during this difficult and extraordinary time should really focus daily on something that is positive. But I also suggest, and this is my perhaps experience after 20 years working in this field, that the best support to patients comes from other patients.
Yeah.
Because no matter how long you've been doing this job like me, but one thing is caring for somebody, one thing is having experienced that yourself.
Yeah.
And I think emotionally it's very important to rely on somebody that has had the same or has been through the same journey.
Yeah.
And given that, as I mentioned earlier on, this is not new, and we will all adapt and get used to it.
Yeah.
I think, I believe that everyone should be given, some thoughts about joining support groups.
Yeah.
And not just focusing on resolving or discussing the fertility issues at home with partners or with a member of the family, but also with people that have been through this before. And what we have seen, and actually it's been very interesting because I've seen this myself, probably more in the last 4 weeks than ever before, that there's been more uptake of looking for emotional support and general well-being by men as well.
Yeah.
And I think perhaps men that have been working from home and have had time to focus on the general well-being and perhaps exercising and looking at different aspects of their life and creating perhaps a better balance, I've also had the opportunity to reflect on what can they do better. And so I have had many men that came back to me and said, do you remember I did a similar analysis 9 months ago, but now I've lost weight, I've stopped drinking, I've stopped doing this, can I do another one? And 9 months ago, they perhaps didn't take into account that drinking or sitting down for 10 hours was going to have an impact on the sperm performance. Now they're actually coming back on their own without anyone saying, come and have another semen analysis. So I also think that I know of some couples that have put the treatment on hold while the COVID-19 pandemic has been going on, and have conceived naturally.
Wow.
So what we need to realize that has been an opportunity for some couples, obviously no individuals, and I think perhaps has helped them to take some responsibility off them.
Yeah. Because
the treatment had not gone ahead, not because they couldn't do it, but because somebody else decided actually it wasn't the right time to have treatment. My final advice is just to be positive, stay safe, and the time has now come for you to perhaps contact the clinic where treatment was about to start, or where you've been waiting to start
Yeah.
a resume. Some clinics are able to do so, and so you need to look at it positively, and you need to have lots of confidence, and keep the normal routine, and maximize your well-being, and I'm sure that the clinics will be happy to help wherever they can. Thank you very much indeed for having me. I think it's been a pleasure, and I wish all patients all the very best, and I wish also Fertility Circle good luck with your plans. And I think is a very important phase of our professional life, and I'm sure that jointly we can do something good for our patient population.